little background on myself. I'm a nursing student. I work 2 part-time jobs, and I do have health insurance. It's the minimum health insurance sort of for catastrophic care, $5,000 deductible. I'm going to start my speech in just a second, but I was injured twice with this health care plan, and I basically did not go to the doctor because I would have had to pay for it all out of pocket. Dislocated my shoulder during the fall and working on the house. I just popped it back in, tied it off, and let it heal itself. And the second time I broke 2 ribs, similar kind of thing. I did a lot of work on houses, and again, the kind of things where you could possibly get through without going to the doctor. And I feel fine now, but it seems ridiculous that I had to not go to the doctor for serious injuries like that. All right. My name's Dan Inkley, by the way. I don't know if I said that. I'm going to take a little different angle on this speech. I know we're talking about a public option. A lot of what I'm talking about is more of a nationalized healthcare service based out of Europe. I think a lot of the points cross over, so I apologize if I'm not exactly on topic, but I'll try to keep it concise as possible. I want you to take a moment and shut your eyes and look at a big round table and see elite people, billionaires of the world, corporatists, politicians around that table, and they're having a discussion. They're saying, okay, we know Europe and Canada has healthcare that works, and they've had it since World War II. How do we sell to the American people that this plan that we've come up with, which requires them to pay 4 times as much, how do we sell this to the American people? This is good for them, good for their taxes, good for the government. Well, that's how I see this public option. I see it as Obama is trying to sell something that is good for America, and he's working against forces that have massive amounts of money for PR, for psychologists. They can discuss how to trick the American people into a bad plan being a good plan. Obama's plan, I believe, is a good plan. I think the private healthcare industry doesn't want it because it's going to cut into their profits. England has had universal health care since 1946. That's after World War II, which means their entire country was flattened. Every city completely burned to the ground, yet they said, how are we going to get national health care? And they did it. So I have no doubt whatsoever America could do the same, and certainly the public option, if not complete universal health care. It works. The World Health Organization ranks U.S. healthcare at 37. That's below Costa Rica. Yet we pay sometimes as much as 4 times as much as Europeans. So we're already paying $4,000 per family for every 1,000 that a European family spends, and yet people are complaining that our taxes are going to be too high for this public option. It's just simply not true. Private health insurance, they skim nearly 10 to 30% for administrative costs. Medicare, 2 to 3 cents per dollar. So as far as private health care being cheaper for us, it's just simply not true again. Some simple points here I'm sure you've heard before. We already have socialized services, police, water, fire departments, military. How do we pay for this? We obviously think socialized programs are all right. We have them. Let's look at what we spend on the military. $1 trillion per year. We have 1,000 military bases around the world. And this is in a time when we have nuclear weapons. I'm not scared that America is going to be invaded. We have enough firepower to destroy the entire world 12 times over. We are not in a place where we need to be scared. We can spend less than $1 trillion on the military and put that towards the healthcare. Wall Street bailouts, $2 trillion at least, probably a lot more than that. Boy, I wish we could have had $1 trillion of that for healthcare. We pretty much just made sure the families behind J.P. Morgan, Bank of America, Citi, and Goldman Sachs didn't lose any of their family money, but we still didn't get healthcare out of it. We give aid to countries that don't need it. Some countries do need it, but there are a few countries that we give billions a year to that already have universal health care. So it seems silly to give a country $3 billion when we don't even have health care, and they do, as far as taxpayer supported. That's about it. In conclusion, I just want to say that I believe echo chambers are the problem. An echo chamber is basically the media outlets that run the story that the elites come up with. They're owned by the elites, and that gets bounced around in their little echo chamber, and then it shows up in the community, on the message boards, on the internet. But it all starts from one small group of people, rich people around a table saying, how do we set policy for this country? So I'm asking people in our district and really in America to think for themselves, open their minds, look online, find other sources for information to decide that healthcare could be, taxpayer-supported healthcare is possible for America and is a public option. Thank you.